Assalamu alaikum. So I am back with another video. This took so long, but anyways, yeah. So this is part one sort of fluoroquinolones. So let's just get started. ये हमारे पास आखिरी antibiotic है alhamdulillah. So this is a bactericidal drug, and this is neither a protein synthesis inhibitor nor is it a cell wall inhibitor, बल्कि it inhibits DNA replication, ठीक है, of the bacteria. We'll get to that later, but इसके अंदर हमारे पास examples हैं norfloxacin की, ciprofloxacin, levofloxacin, moxifloxacin, ofloxacin, but इसके अंदर जो prototype drug है, that is ciprofloxacin, just something to remember. इसके अलावा you should know that the first component of the fluoroquinolones that was discovered was nalidixic acid, which is a quinolone, यानी ये fluorinated नहीं है, इसके अंदर fluorine नहीं है, and this was used to treat uncomplicated UTIs caused by gram-negative organisms. Remember, uncomplicated. ठीक है, तो इनसे फिर हमारे पास ये बाकी fluoroquinolones derive हुए हैं, which are all synthetic and they're fluorinated nalidixic acids. Okay, coming to its mechanism of action, so it has two sort of separate mechanism of actions in gram-negative and gram-positive bacteria. In gram-negative bacteria हमारे पास जो bacteria का जो अपना DNA होता है उसके अंदर there is this super coiled portion, ठीक है, this is normal coiling, बीच में एक super coiled portion होता है, तो in order for the DNA to get replicated this super coiled portion needs to get uncoiled. तो इसकी जो uncoiling है वो DNA gyrase या topoisomerase, both are the same thing, but topoisomerase 2 is also called DNA gyrase. It unwinds this supercoiling and that allows the DNA to replicate, ठीक है. In gram positives जब दो DNA बन जाते हैं तो they're basically entwined and you need to like separate them into two separate daughter DNAs. तो उन separation के लिए you need another enzyme called topoisomerase 4. So what fluoroquinolones do is that they inhibit topoisomerase 2 in gram-negative bacteria and they inhibit topoisomerase 4 in gram-positive bacteria. तो इस तरह DNA replication यहाँ पे stop हो जाती है, ठीक है. Next, coming to its pharmacokinetics, not that important, but you can give it orally, topically or IV, which means you can use it for a bunch of stuff. But इसके अंदर एक exception है कि this is true for all the floxacins except norfloxacin, जो कि IV में नहीं दे सकते. You can only give it topically or orally. And when you give it orally, you should never give it with calcium, magnesium, iron, or any other antacids with positive or negative ट्राईवेलेंट या डाईवेलेंट कैटाइंस के साथ नहीं देते क्योंकि फिर उसकी अब्जॉर्प्शन इम्पीड होती है. सो दिस इज़ अ बिट लाइक टेट्रासाइक्लिन्स इन दैट एस्पेक्ट. व्हेन यू गिव इट हैज़ अ वेरी हाई वॉल्यूम ऑफ डिस्ट्रीब्यूशन. तो इधर से हमारे पास सोर्सेज के यूजेस भी आ जाते हैं. इट गेट्स डिस्ट्रीब्यूटेड इन द प्रोस्टेट ग्लैंड, द बोन्स, इन द यूरिन, इन द किडनी, एंड इट गेट्स एक्सक्रीटेड इन द किडनीज एंड द लिवर, मोस्टली इन द किडनीज, ठीक है. अब इसके फार्माकोडायनामिक्स में थोड़ा सा हमारे पास आ जाता है कि इट इज़ a very strong inhibitor of cytochrome P450, जिसका मतलब है कि थियोफिलिन और वारफरिन वगैरह ज़्यादा हो सकते हैं when you give it with fluoroquinolones. But ये इसमें से सिर्फ हमारे पास norfloxacin, ciprofloxacin and ofloxacin are the fluoroquinolones that are cytochrome P450 inhibitors. इसके अंदर an easy way to remember it that the respiratory fluoroquinolones are not the inhibitors. Respiratory fluoroquinolones के अंदर we have levofloxacin and moxifloxacin, ठीक है. तो if you remember this is also an LO from KMU. तो the respiratory fluoroquinolones are levofloxacin and moxifloxacin. उसके अलावा जो सारे हैं those are inhibitors. Now coming to its spectrum, so this is used for both gram-positive infections, gram-negative infections, some anaerobic infections, and in gram-indeterminate bacteria as well. ठीक है. So coming to gram-positive, gram-positives के अंदर mostly we use ofloxacin, but this is not like a rule of thumb that you should remember. And I didn't really spend a lot of time देख के कि कौन सी specific fluoroquinolone हर चीज़ के लिए इस्तेमाल हो रही है, because I just don't think that's high yield for now. If it is, if I see MCQs about it, I'll post them in the comments अगर कोई इस तरह additional चीज़ हुई तो. Anyways, for gram-positive organisms, we use the ciprofloxacin, C for ciprofloxacin, to treat bacillus anthrax infections, which causes pneumonitis and eschars. And this is like an important used for it. Secondly, it's also used for staph aureus infections. हमारे पास soft tissues infections आ जाते हैं, skin infections आते हैं, especially diabetic लोगों के foot infections आ जाते हैं. However, there is some resistance to fluoroquinolones when it comes to staph, so it's not really the first thing that you use. Another very important use for it, like I said, is to combat strep pneumo infections, which cause community acquired pneumonias and bronchitis. तो उसके लिए we use the respiratory fluoroquinolones, which are levofloxacin and moxifloxacin. इसके अलावा for other strep species, बल्कि for strep pneumo, you also use this for sinusitis and otitis. ठीक है? Yeah. And you can also, in gram-negative bacteria, which is, I think it's wider use, you use it to treat diarrhea and gastroenteritis, yani GID complications, and you also use it to combat complicated UTIs. ठीक है? तो gram negative के हमारे पास E. coli, Shigella, Pseudomonas, these all cause diarrhea. और ये जो सारे हैं fluoroquinolones that can treat this, except norfloxacin, which does not treat Pseudomonas. उसके अलावा जो हैं वो सारे Pseudomonas के लिए भी इस्तेमाल हो सकते हैं. इसके अलावा use this for salmonella infections, particularly typhoid, which again is इसके लिए specific जो हमारे पास fluoroquinolone है, that is ciprofloxacin, that used for typhoid infections. You also use this for salmonella causing gastroenteritis and for osteomyelitis, because it again has like a very high volume of distribution. It also gets distributed to the bones, so you can use it for that. क्योंकि salmonella हमारे पास mostly osteomyelitis cause करता है in patients with sickle cell anemia, so you use it for that. इसके अलावा you use it for for complicated UTIs, because it has a very good distribution into the kidneys and the urine. So complicated UTIs caused by E. coli, Proteus, Enterobacter, and you can also use it for pyelonephritis, because it does get distributed to the kidneys, जो हमारे पास fluoroquinolones हैं. And we talked about community acquired pneumonias, but you can also use fluoroquinolones to treat Legionella and Mycoplasma pneumonias, which are atypical pneumonias, yeah, walking pneumonias, and you mostly use ofloxacin, but you can also again use levofloxacin and moxifloxacin for this. I'm not going to go into the detail of that, but yeah, you also can use ofloxacin to combat chlamydial infections. Gonorrhea के लिए भी use होता है, but it's not like first line, but yeah, you can add gonorrhea and chlamydia both. They mostly go side by side. इसके अलावा you use this to treat prostatitis. Specifically, you use ciprofloxacin for that. So because it has access to the prostate gland, you also use it to treat conjunctivitis, because you can give it topically. You can use it to treat mycobacterium tuberculosis, especially multi-drug resistant और multi-drug resistant MAC infections, जो कि हमारे पास pneumonia cause करते हैं AIDS patients. ठीक है? And you can also use it to treat Mycobacterium leprae for leprosy. So these are the uses. Okay, so coming to its side effects, though it has some GIT side effects like nausea, vomiting, diarrhea, and all of that. Importantly, it has some very strong CNS side effects, such as it can cause normal hallucination and convulsions, but it can also cause peripheral neuropathy, and it is contraindicated with NSAIDs because इसकी वजह से इसके CNS side effects बहुत ज़्यादा हो जाते हैं for some reason, and it is also contraindicated in epileptics because of this. It also has some very serious MSK side effects. इसके अंदर एक बहुत यूनिक साइड इफेक्ट जो fluoroquinolones का give away है, it causes tendon rupture. So yeah, if you need to remember this for fluoroquinolones, and it also causes articular cartilage erosion, जिसकी वजह से it is contraindicated in children because it can hinder their growth by eroding their articular cartilage and can cause tendon rupture, and it is also contraindicated in pregnant women because of this, because of this effect. इसके अलावा it also has a CVS effect, which is it prolongs the QT interval and causes arrhythmias, and this is most prominent in moxifloxacin. So additionally, it can also cause photosensitivity and hypersensitivity reactions. So the modes of resistance that fluoroquinolones use are chromosomal mutation and efflux pumps, because ये हमारे पास concentration dependent killing करता है, यानी इसकी concentration जितनी ज़्यादा होगी उतना इसका effect होगा. तो if the bacteria can just throw it out of the cell, तो it won't have any effect. It does not use plasmid mediated resistance, So that's something to remember. And this is mostly used for organisms like Neisseria, staph, anaerobes, and also some एंटेरोकॉकाई. ठीक है. इसके अलावा कुछ एलोज से रिलेटेड बात है कि उसमें था कि मॉक्सीफ्लॉक्सिसिन की हाफ लाइफ की बात करें तो मॉक्सीफ्लॉक्सिसिन हैज़ अ वेरी हाई हाफ लाइफ of approximately 12 hours because it has a very low clearance rate and because it has two pathways of excretion through the liver and through the kidneys. इसके अलावा I talked about respiratory fluoroquinolones पीछे, but apart from moxifloxacin and levofloxacin, gemifloxacin is also considered respiratory fluoroquinolone, जिसका mechanism of action and all of that is the same as levofloxacin, but just to remember the name. So yeah, that's all